Inflammatory bowel disease, or IBD, is a term for chronic conditions that cause inflammation in the digestive tract. The two main types are Crohn's disease and ulcerative colitis. Both can cause significant discomfort and affect daily life, but there are important differences between them. Crohn's disease can cause inflammation anywhere along the digestive tract, from the mouth to the anus. It often affects the small intestine and the beginning of the large intestine. Inflammation in Crohn's can penetrate deep into the layers of the bowel wall, and it often appears as patches of inflammation with healthy tissue in between. Ulcerative colitis, on the other hand, is limited to the colon and the rectum. The inflammation affects only the innermost lining of the colon and is continuous, without healthy tissue in between affected areas. Both Crohn's disease and ulcerative colitis share many symptoms, including abdominal pain, diarrhea, fatigue, weight loss, and urgent bowel movements. They often begin in teenagers and young adults, but can occur at any age. The causes are not fully understood, but are thought to involve genetics, the immune system, and environmental factors. The main differences are location. Crohn's can affect any part of the digestive tract, while ulcerative colitis is limited to the colon. Pattern. Crohn's causes patchy inflammation with healthy areas in between. Ulcerative colitis causes continuous inflammation. Depth. Crohn's can affect all layers of the bowel wall. Ulcerative colitis only affects the inner lining. Crohn's can cause mouth sores, anal fissures, and fistulas. On the other hand, ulcerative colitis often causes rectal bleeding and blood in the stool. Diagnosis usually involves a combination of medical history, imaging, and procedures like colonoscopy. Treatment aims to reduce inflammation and manage symptoms. This can include medications, lifestyle changes, and sometimes surgery. Working closely with a healthcare provider is important for managing these conditions. Living with Crohn's disease or ulcerative colitis can be challenging, but with the right care, most people can manage their symptoms and lead fulfilling lives. If you or someone you know has symptoms of IBD, talk to a healthcare provider for proper diagnosis and support. Remember, you're not alone. Millions of people live with IBD. With education and support, you can take control of your health. If you have concerns about your digestive health, reach out to your doctor today. Thank you for watching. Resources for more information.